Let's talk skin removal. And why is this such a common thing that we see come into our office? Once skin is stretched out, it often doesn't rebound as tight as you might want it to. With things like weight gain and weight loss, pregnancy, and even just aging, our skin loses some of its ability to rebound as tight as we might want it to. At the tissue level, our skin loses some of its collagen and elastin, and this is some of the connective tissue that allows the skin to rebound after it's been stretched out. So when we're younger or with smaller changes in weight, your skin will rebound back to how it was before that a little bit of extra weight was on there. But as you age or with extreme weight gain and weight loss or things like pregnancy that really stretch the skin out, it loses that ability. And it's like if you were to blow up a small balloon. You'll blow it up really big and it'll rebound some, but it's not gonna go back to as small as it once was. These changes can occur anywhere in the body, from the face all the way down to the legs and the feet. And while some of the corrections to this might be a trade-off for a scar, sometimes those scars might be smaller, but even if they're bigger, we try to conceal them in an area that's easy to hide in any garment, bathing suit, bra, clothes, or whatever you're gonna wear. Some things you might notice that would tell you that your skin doesn't have that rebound potential is that you've gained and then lost some weight, but you still have a little bit of loose skin, or you might have something called stretch marks that are another sign that your body has lost some of its elastic potential. Stretch marks are scars in some of the deeper layers of the skin, and once they're there, like any other scar, they are permanent, and the only way to get rid of them is really to cut them out. Often, in some of the procedures that we use to correct for that loose skin though, a lot of the stretch marks go away with the skin that we cut out. There's some less invasive technology that doesn't require the big incisions, like Bodytite or Quantum, which is a radiofrequency technology that heats up from the underside of the skin, and it causes some increase in the collagen of the skin and tightening of the skin. This is good for less stretched skin or not a lot of loose skin around the body. Even if we're gonna do a procedure where we might be cutting out some skin, we can use that radiofrequency technology from the face or the jawline to the arms, to the tummy, the chest, all the way down to the legs, and it adds about 30% tightening to your skin's own natural elasticity. Now, it's not a magic shrink wrapper. It's not gonna suddenly suck your skin back to how it once was way back in the day, but what it will do is add some tightening to your skin. Sometimes that radiofrequency technology might not be enough to get the tightening that you want. We have to do more invasive things like actually cut the skin out. In the breasts, that's gonna be something like a breast lift where we actually cut the extra skin out, rearrange things to get you that more youthful look. We can do things in the arms like a brachioplasty where we actually make an incision along the arm and cut out the extra skin to help with that hanging skin that you might have that might be preventing you from wearing some of those sleeveless shirts. There's different techniques to do each of these procedures, and every plastic surgeon is going to have their own way to hide the scars. I try to hide my scars in an area that's concealed where most of the times and most of the mannerisms that you're going to be doing where it'll be concealed as much as possible. For guys, you might have loose skin in the chest that's causing you to not want to go shirtless at the pool or might not like how you look wearing some shirts even. We can do that Bodytite and liposuction to help with some of that skin, or you might need some of that skin cut out, and we can try and hide the scars to make it so it's not that obvious for you. If you've got a lot of loose skin in the midsection or the tummy area, what you really need is a tummy tuck. That's gonna allow us to cut out all of that loose skin. The length of the scar just varies about how far around your loose skin goes. It can be a mini tummy tuck, a standard tummy tuck, or an extended or circumferential tummy tuck that wraps all the way around to the back. We'll decide how long the scar needs to be on our exam and just based on your goals and how much extra skin you have. In addition to the skin removal in a tummy tuck, we'll do things like tighten up the muscles in the midline, and we can also add on some liposuction and some skin tightening like Bodytite or Quantum to help with loose skin in other areas. Some people who have lost a lot of weight have some loose skin or sagging to their middle of their back, which causes the butt to sag a little bit. For that, we can do what's called a circumferential tummy tuck or a lower body lift to help lift the butt up as well as take out some of that extra skin of the mid-back. Moving down the body, we can talk about the legs. In the legs, if you've got too much loose skin that's not going to be corrected by the liposuction and Bodytite or Quantum alone, we might need to cut that loose skin out, and that's with the thigh lift. There's varying degrees of thigh lift. It might be a longitudinal thigh lift where it's kind of from the knee to the groin is where the scar goes, and that's if you have a lot of loose skin all the way from the groin down to the knee. We have to cut it out. It's a trade-off for a scar, but for the contours that we're going to get for it, it's usually worth it, and we try to hide that scar in an area that's easy to conceal. If you've got loose skin that's kind of just at the upper part of the leg, sometimes we can conceal the scar just with a groin crease thigh lift where you don't need the scar running down your leg, but that's only for a certain population of people who are really good candidates for that. All of these procedures that I've talked about are trade-offs for scars, and that's something that sometimes is hard for patients to really come to terms with and understand. But to correct some of these contours and some of this loose skin, we've got to cut it out, and the only way to do that is to trade it for a scar. Again, go to somebody who is well trained in this and who does this stuff a lot, because they know how to hide these scars well and how to get your scars to heal as well as possible. In my practice, I use a lot of techniques during surgery to try and help get the best scar quality possible. Part of it's also about genetics too, and everybody's scars heal a little bit differently. But in addition to during surgery, we'll also use some scar treatments after surgery to get your scars to heal as well as possible. Initially, we're just gonna have you make sure that we're avoiding any infection, keeping things clean, and then once things have healed up a little bit, we'll use things like scar massage and scar creams and silicone-based scar creams particularly that can really help get you good quality to the scars. We'll keep an eye on things in the long term, and if we need to add other things like lasers or other types of creams to help with the quality of the scars, we can add those in, but we're gonna keep an eye on things together in the long term and make sure these scars heal as well as possible. Depending on the different areas that you might have loose skin or that you want corrected, sometimes we can do this all at one time, even if it's different areas of the body. But sometimes, depending on the amount of skin you have, we might need to stage these procedures. This is really common in people who've had massive weight loss and have lots of loose skin all over the body. We'll do this for safety and also to get you the best results possible in the long term. I'm Dr. Jeremy Bosworth. If you've got loose skin, whether it's just a little bit or a lot, check out our website and some of my social media for some results. And if you want to schedule a complimentary consultation, call or message us and we'll get you scheduled.